Ducey. This letter outlines a request to delay in-person learning until October and was signed by over 100 school board members from across the state, along with over 1,000 parents, physicians, and education advocates. Since the reopening of our state, Arizona has become #1 in the world for positive cases per capita. There have been at least 122,479 cases of coronavirus, and just as of yesterday evening, as of Sunday evening, at least 2,239 people had died. 2,239 people have died. This includes, that we know of so far, 2 of our wonderful teachers. Our prayers are with their grieving families, but that is not enough. So I'm here to take action. As a school board member and a parent, my #1 priority is the safety of our students, staff, and community members. I cannot, in good conscience, put our youth at risk by restarting in-person instruction. To do so would be reckless and irresponsible. However, make no mistake, we know that the best education happens in the classroom. We know that our teachers miss their students dearly. And to quote a teacher that I recently spoke with regarding the reopening of school, she said, "I am dying to go back to work, but I don't want to die because I went back to work." Governor Ducey and I took the same oath to faithfully discharge the duties of the office to which we were elected. I intend on honoring my oath, and I ask that the governor do the same. Leadership is needed now more than ever, and my colleagues and I are doing our part. Now we are asking the governor to do his. It is his duty to ensure that our schools are fully funded and able to deal with the challenges we are facing. This pandemic has highlighted many inequities that have been around for decades. Our Black, brown, and indigenous communities are getting hit the hardest. Many of our school districts lack the funding needed to operate under the CDC guidelines. Access to COVID-19 testing continues to be a struggle for working families, and the lack of connectivity and data infrastructure makes distance learning difficult for many of our rural districts. Yet, school districts have their hands tied behind their backs due to the governor's executive order, which states school districts must offer in-person instruction or risk lose funding. At the same time, our schools are being threatened with the loss of federal funding by President Trump and Secretary of Education DeVos. We hope that the governor will put the interests of Arizona's students, teachers, and families before the misguided interests of this administration. We're all here. We want to help mitigate the spread of the COVID-19 virus, not contribute to the higher and higher numbers of outbreaks and deaths in our communities. With this, we ask for the following: statewide closure of buildings and classrooms until October 1st, or the date on district academic calendars that marks the end of the first quarter of instruction. In October, districts may consider reopening buildings and classrooms for in-person learning. We meet upon agreed levels of COVID-19 data points that show a reduction of risk and infection in our communities. In October, districts may reopen buildings and classrooms when we meet upon agreed safety protocols and requirements as determined by the Center for Disease Control and the Arizona Department of Health. We also would like the governor to fund distance learning at the same level as in-person instruction without the requirement to also provide face-to-face classes 5 days a week. We would also like to be given clarity and assurance that every school receives 100% of their prior year funding through the Enrollment Stability Grant, despite the COVID-19 specific related expenses we may incur. We would also like the governor to waive the 180-day instructional day requirement for the school year, for this upcoming school year. We'd also like to suspend the statewide standardized assessment for this upcoming school year and allow districts to use local assessments to track academic progress for accountability purposes. We also ask that the Arizona Department of Education to submit an extension or a new waiver for the USDA school lunch program, so our schools can offer to-go meals to students even when our campuses are closed. The nation's eyes are upon us. Let us be the example of what leadership and courage is in a time of crisis. Thank you.
Good afternoon, everyone. I'm Adam Lopez Faulk, the clerk of the governing board for the Alhambra Elementary School District in West Phoenix. And I'm so excited to be here, joined by my colleagues and education advocates, working to make sure that we're protecting Arizona's teachers, our school staff, as well as our children and their families. So in March, Alhambra was one of the first districts to close, which actually was the first district to close. We came off of spring break and decided that we weren't going to put our kids back in our classroom because COVID was starting to rear its ugly head in our state. Here we are a few months later, and we're trying to send our students back to schools as our numbers continue to rise. And as Devin Del Palacio said, we're now first in the world that are affected by COVID, and it's so important for us to be keeping that in the front of our mind when we make these decisions. We don't make these decisions for our schools without the input of our community members, our parents, our teachers, our staff members. This is all done by keeping them in mind and working with them to get the answers from them. Now, we're contacted on a regular basis from teachers and from staff members, and I can speak for everybody with this, that reach out to us telling us that they're scared, telling us that they're worried about going back to school, not sure if their district is able to do everything it needs to do to truly protect them. They live in households that are multi-generational households. They might have an underlying health condition that'll be affected if they go back to a campus and contract COVID-19. And we're already starting to see that happen. Unfortunately, it happened in Hayden and Winkleman, in one of our rural communities that mean so much to the future of the state and are affected so negatively by a virus such as this. I've been contacted by teachers who have said that they're getting their wills together because they're afraid of going back to the classroom. And think of that, people in their late 20s and 30s are writing their wills right now because they're afraid of going back to the school, and they want to make sure that their affairs are in order if something was to happen to them. That's absolutely terrifying to me. And the prospect of putting our teachers and all of our staff members, from bus drivers, admin staff, cafeteria workers, supporting staff of any kind, putting them back in a situation that puts them and their families at risk, is very, very scary to me and very, very scary to us. My district is a very diverse district. We're overly Latino, very high poverty rate in my community. These are families that live in households where Nana and Tata live there, Theo lives there. There's multi-generational people in that household. And if one of those kids comes home with something, it's possible that they could spread that to someone else in their family, and we could see the loss of lives at a scale we haven't even seen yet. We don't want our schools to be centralized locations for that. And it's so important that we come together as school board members and ask the governor to back us, to support us, and to allow us, and this is for every district across our state, to fully fund our distance learning programs and to ensure that we don't need to come back in person until October 1st at the very least, to make sure that we can keep all of our kids and our staff protected and safe. Thank you.
Hello, my name is Dr. Dion Mills. I'm a board-certified obstetrician gynecologist working as an OB. First, do no harm. That is the oath that I and all other physicians have lived by. My job as an obstetrician gynecologist, a surgeon, a doctor of 2 patients all in one, is defined by making decisions that have life and death and long-reaching implications. I'm the mother of 3 precious children, and I believe that my job as a parent is just as critical. I, along with thousands of my colleagues, have been watching in horror how the leadership in this country and state have behaved as if their actions didn't also have life and death implications. I, along with thousands of my colleagues in medicine, have been watching in disgust as the predictable sequelae of anti-science, anti-intellectualism, anti-facts, mixed with selfish entitlement and weak leadership, has played out in the midst of a pandemic. You called us heroes a few months ago, and I will tell you that thousands of us cringed because we knew that the same people thanking us for our service did not fight for our protection. We're watching hundreds of our colleagues die because they were forced to run into the proverbial burning buildings without even so much as a fire-resistant coat or an oxygen tank. We watched as basic scientific principles were distorted in the media and truths weren't told because those that were put to lead us somehow decided that lives lost was better than careers jeopardized. People called teachers heroes too. Once again, the same people who were singing the praises of their teachers a month ago are now the same people writing hateful letters, demanding that those same souls put their lives on the line for children who are not their own. First, do no harm. I will be honest. My heart is heavy and I am angry. I work for 24 hours at a time watching wave after wave of pregnant patients come in, struggling to breathe. I watch as their unborn babies' lives are affected and jeopardized. I manage these patients with the help of my infectious disease and pulmonary colleagues, and sadly, my intensive care colleagues have had to be involved as well. We all work alongside amazing nurses and technicians. We are all working hard to keep people safe. At a time when COVID patients are feeling like lepers, I don't hesitate to touch and to comfort. We are all working hard to collaborate and share new information in our efforts to fight this disease. We worry about our possible exposures and do everything we can to prevent this deadly disease from coming back home to our families. So then I change my clothes, I clean my badge, I wipe down my keys, and then I leave the hospital only to stop for gas and see a store full of unmasked people going around their day as if nothing is amiss. So many of our brothers and sisters in medicine have been killed because of their exposure to people who didn't have to get sick, including my cousin, Debbie Ann Stewart, a devoted nurse who watched over 40 of her patients die before succumbing to the virus herself. I and many of my colleagues have sat repeatedly perplexed when the benefits of wearing a mask were debated as though we didn't already have a mountain of data to support it. I and many of my colleagues have watched in horror as this state chose to defy the data, science, and all reputable guidance. We watched the slow motion train wreck caused by weak leadership coupled with selfish citizenry. Governor Ducey has shown that he has a gross lack of judgment, insight, moral and ethical clarity, or courage. He has acted as a leader in name only, who, when having to actually lead in action, lacked the will and courage. He acts indecisively and has sought shelter in ambiguity. He has taken every opportunity to shirk his responsibility to make the changes that are within his power to make, leaving it to those below him to compensate for his lack of leadership. Dr. Kara Christ has embarrassed, frustrated, and disappointed many of us physicians. To have a background in virology and microbiology as well as having worked in epidemiology, to not vocally and transparently champion following the science is not only shameful, but has cost many lives. Nothing that our leadership has done in this state of Arizona has been done with the science in mind. Instead, the facts, the data, the science has always been treated as an afterthought, a nuisance amidst the more appealing pull of popularity and capitalism. There are many children and parents who do not have the luxury of staying at home because not all employers are making it possible for their employees to work from home, and some jobs cannot be performed remotely. Those most vulnerable, low-income families, special needs children, children living in toxic home environments, children living in internet deserts, all depended on the rest of us to do our part so that it would be safe to return to school. But this state chose not to think of them as they went to barbecues and parties or to the bars on Mill Avenue. And they are certainly not thinking of them now as they demand that they return to school. What is really important here? Where is the respect for the sanctity of life? As an obstetrician gynecologist, I am constantly advocating for the life of the unborn while championing the life of the precious being carrying that child. As an OBGYN, I cannot stand aside and see that the lives of our children and teachers are being unnecessarily jeopardized because of choices our leaders refuse to make. Follow the science. Handling of a pandemic is a public health issue and should be managed as such. This is not a popularity contest. If Arizona wanted the schools to be safe for children and teachers, then everything would have been done to keep community spread contained. That is not the case. You cannot have your cake and eat it too. Our hospitals are in surge capacity, and crisis care is being provided. We have astronomical positivity rates, and hospital admissions have nothing to do with how many tests we are doing. You cannot fake respiratory and multi-organ failure. So now here we are. We cannot in good conscience reopen the doors of our schools. First, do no harm. Fully fund public schools so that they have the ability to follow the science while providing the social, emotional, and physical support for our students and staff. Thank you.
Good afternoon. My name is Lindsay Love, and I come to you today not just as a school governing board member, but as a licensed clinical social worker, a behavioral health professional who is tired of the shameless exploitation of social emotional needs of students to send our students back into a situation which we know is dangerous for political gain. I come to you as a high-risk member of the community myself, who has watched this shameless exploitation go down from my home, because I can't go out because of my asthma. And I am risking my life today to be here to tell Governor Ducey and the rest of the state and our country to stop it.
Yeah.
Woo. Governor Ducey, taking a gamble on the health of our students and teachers is simply abusive, and you have a duty to protect the health and wellness of our families during this health crisis. Let me be clear, as my other colleagues have stated, we want students back in the classroom just as much as anybody else. As a behavioral health professional, I know of the risks that occur when students are not in the classroom. However, those risks do not outweigh the risk of a physical health issue that is plaguing the country and the world. It's a pandemic. It's a novel virus. We do not have interventions for it, but we certainly have interventions for domestic violence, for child abuse, and it is going to take a community approach, not just our teachers, to address those needs. We as school board members, doctors, behavioral health professionals stand up here today wanting to be able to guarantee the safety for our students, their families, and their teachers upon the return to the classroom. With Arizona being the #1 hotspot for COVID, sadly, we cannot in good faith and confidence guarantee that safety, physically or emotionally. Opening schools only to have them potentially shut down 2 weeks later will result in more emotional harm on top of significant physiological damage to our students, our teachers, and our families. I firmly believe in integrated healthcare approaches that center the whole child, but I can confidently say that the focus on emotional health over physical health and safety of our students and community shows this plan lacks a solid foundation, Governor Ducey. Let us reflect on Maslow's hierarchy of needs, in which physiological needs and safety always come first before our behavioral health needs, because they can impact our behavioral health needs. I have worked with clients who have had to watch their parents on a couch struggling to breathe, while my professionals have to tell them how to isolate themselves so that they don't get it and take care of their younger siblings. And that is absolutely ridiculous, Governor Ducey, and you should know better and do better. We cannot expect students and teachers to operate on excellence expectations in our school system when our students and teachers are both in crisis. There's a threat from COVID. There's a threat to housing. There's a threat to securing food and other impacts that disproportionately impact Arizona families. Teachers cannot be doctors, nurses, behavioral health professionals. They need the support from the community at large to address social determinants of health that impact our students during this time. If teachers get sick, Governor Ducey, who does the state propose to sacrifice next? Our state needs to provide resources and alternatives to support our families, such as state-funded daycare for essential workers, food boxes, and a continued freeze on evictions to support our most vulnerable families. And schools are part of the community, and it's time that we use a full community approach in healing at this time. We should have been doing it before, but sadly, we were not. I'm proposing that Superintendent Hoffman embrace models in which school counselors offer virtual, telehealth, and telephonic office hours to address the social emotional needs of students and families. This can be done individually, it can be done in families, it could be done in group settings so that they get peer interventions. It could be done upon crisis as well. We need to look at online social emotional curriculum that can be used with teachers and social workers for continued support and intervention. We need to look at home visits and welfare checks as a last resort for our most emergent and high needs families. And we need to fund the PPE to be able to do that, because I'm not going to send school social workers out into the community unprotected so that they can risk their lives here too. Threats of physical harm from DV and child abuse are concerns. We need to look at how social workers and nurses can provide safety for the families in need. We need to be collaborating with child welfare agencies, animal control, because we know that people will report abuse to a dog before they will report abuse to a human, unfortunately. And so we need to train our animal control professionals when they're stepping into households to be able to recognize the signs of abuse with the humans in that home. We need to foster community partnerships and with other stakeholders who work on those community-based issues such as domestic violence and child abuse. When you see something, we need to say something. There are studies that look at using a natural disaster model during COVID-19 to address DV and abuse and neglect that our governor and Superintendent Hoffman really need to be looking at. There are very real threats to teachers, paras, and staff from COVID. Their mental health is important too, and they've gone through this crisis along with the rest of us, and we need to not forget that. We need them safe, we need them protected during this crisis. They need additional resources for counseling services themselves. Last thing we need right now is mandatory state testing, for crisis. We need to cancel state assessments for this year. Setting high expectations when people are in survival mode, that is unacceptable, and it is not trauma-informed. We need to train our support staff to be case managers, to support our school nurses and social workers, and providing support and resources to families. We also can use our support staff as translators for our families as they are so desperately in need of that. And if you care about social emotional wellness of students, where is the funding for additional social workers, counselors, school psychologists, and nurses around this crisis? We need to hire more mental health staff and nurses and provide them with PPE, as I've said, to meet these needs head on. We also need to work in collaboration with behavioral health providers who are already doing the work so that we can wrap these children and their families in service. Governor Ducey, Superintendent Hoffman, and our legislators, we are calling upon you to do what is right. If you open schools this fall and we see an increase in infections and death, you will have the blood of our students, our teachers, and their families on your hands. Thank you.
Hello, I'm Dr. Meredith Workman. I'm a pediatric plastic surgeon who has been caring for children in the Phoenix Metro since 2012. I do not profess to be an expert on COVID-19 or epidemiology. I can provide medical advice and experience based on my professional background and current science shared by the medical community. There is a common misconception that COVID-19 does not affect children. This simply is not true. The virus presents a legitimate threat to the health of our children. COVID-19 does infect children and adolescents and can cause a variety of symptoms, both mild and severe. Fortunately, in the majority of children, the symptoms are mild or may even be non-existent. However, that is not a reason for false assurance. Rather, this should be a reason for enhanced vigilance, because we simply cannot make an assumption about the absence of infection within a classroom without symptoms. Without symptoms, the disease can become widespread amongst peers, faculty, staff, teammates, and families. And regarding infection in children, we continue to learn about the potential effects, both short and long term. There is potential for systemic inflammatory response, sepsis, cardiac complications, and even, rarely, death. This is from early data, relatively speaking. And there will be volumes to be written in the future about what we will know then. But that is knowledge we simply do not have now. Assuming safety because we have not yet experienced tragedy would be foolish. Even if COVID-19 does not infect a child, it will certainly affect them. We are currently in the midst of a surge in cases, and the introduction of school will certainly increase that caseload further. This is what affects children. Over the past 3 months, children's health care has been delayed or limited. I care for children whose surgeries, planned months in advance, have been canceled due to strains on the healthcare system. Pediatric floors have been converted to adult wards. Pediatricians are assisting with coverage in adult ICUs. Nurses, respiratory therapists, environmental services have been diverted to deliver care where most needed. When we strain the system because of adults, children suffer too. And the adults who are infected, these are the children's teachers, their caregivers, their parents, their coaches, their grandparents. How would your serious illness affect the children in your life? I speak of the dangers of COVID infections in our children, but let me temper that by saying I understand the sense of urgency that many feel regarding school. The absence of school services as a result of COVID is a real threat to the health of our children. Online schooling presents a challenge in so many ways for our youngest students, for our students from challenging socioeconomic backgrounds, students without computers or internet access, students whose parents may not speak English, those who depend on school for therapy services or even for meals. These are our most vulnerable students. And our plan for school must include security for them as well as safety for all. It is critical that meal programs, wellness checks, social services, and therapies be given special consideration at this time. There is cost to providing these services, but there is cost to denying them as well. In clinic, parents have already told me that the gains of fall and winter quarters last year were nearly erased by spring. We must have plans for social and special education services for these students. Desperate as we are to return to the normal we once had, the answer to the problem is not school right now, but rather school done right. Educational leadership, with the advice of physician experts, should determine safety for students, teachers, staff, and families. This includes when to start, who to start, and how to start. It may not be popular, but it is necessary. There will be vocal criticism either way, so let's at least back it up with best practice guidelines in science. I have young school children, pre-K, kindergarten, 4th and 6th grade. Let me be the first to say that I do not know how we are going to make this work. But as my daughter reminds me of Princess Anna's words, over and over and over and over and over, we must do the next right thing. Thank you.
That concludes all of our speakers for today. We're now available for any questions.
education is one of those things that really does bleed into all other areas of life. It's not just the student, but it's also the teachers, it's also their parents. And, my first question would surround that October 1st date. Where did that date come from?
That date came from a consensus to buy us enough time to be able to effectively plan. That October date is not set in stone, and that October date does not mean we want to reopen if we're still in crisis mode. What that date was to give us an opportunity to reassess and reevaluate and to see if we would get the support from the governor to be able to open up safely, perhaps with the following year. So, but that date was collectively decided upon as a group of school board members and physicians and folks who signed on to that petition.
You've also made it clear that you feel collectively that there's been a failure of the leadership from the top with the governor, along with Dr. Chris, a failure to medical professionals across the state. Have any of you actually had any interaction with either of them throughout this process? I know that has there
emails, reaching out to them, sending them other sign-on letters.
You might come into the
Just emails we have sent out to the governor with other organizations. I'm also with the Black COVID AZ Task Force. We have also asked them for testing. In my district in particular, I have been reaching out to try to work with our mayor to utilize CARES Act funding to help open up testing locations so that families would feel safe coming back and forth to school.
What has their response been through those emails?
I have not received any type of response. It's been neglect, as if we don't exist. So we have to think about multiple ways of coming together, and by bringing this letter from school board members, this is the way that we want to come together to make them well aware, which I believe that they are, but they are choosing not to have accountability. They are choosing to lay the burden on a school district and governing bodies to do what they were supposed to do, and that's provide effective guidance with research-based data to help us move forward with safely opening our schools.
And we'll say this, just real quick from all the board members that are here. Show of hands if you've been in contact with Governor Ducey or Dr. Chris. So that answers your question. But we would welcome that relationship to work with the governor to be able to talk about how to effectively open our schools, especially since we are the elected or duly appointed governing authority of our local school districts.
He won't even address us when we're at the press conferences. At the press conferences, he won't even address us. He will actually say, I will work with superintendents and principals and parents, but he will not address us directly. We wrote emails, he won't address us. So we're asking you to maybe ask that question again. Why won't you address us?
Some states have come out with criteria on what the level of spread would be, where it would be okay to reopen. Do you guys have any idea what level of spread you'd be comfortable with?
So the World Health Organization and Johns Hopkins has recommended that we have a positivity onboarding with reopening. We are at about 24%. And that indicates that not only do we have a high amount of infections, but it also means that we're not testing enough people. We're only testing the sickest people, the ones who look convincing, which means that there are other pre-symptomatic people out there in the community infecting other people that we aren't catching. So that also tells us that it's not safe to have all of our businesses open. This state has never met proper CDC and World Health Organization guidelines for reopening in the first place. We were never met the criteria for phase 1 reopening in the first place, and that's before we had these numbers.
Are there any states that you have pointed to as leading the way to following these criteria?
There are, last time I looked it up, there were 5 states that actually are less than or equal to 5%. The rest of the 30-something states are in the same boat as us, but of course we're like number 1 or 2. Last time I checked on the Johns Hopkins website, we were second to Puerto Rico for positivity rate. But I know that California is at about 7%, and they're already re-shutting down, re-locking down, and they've chosen to go online with a positivity rate of 7% because they're following the guidelines about less than 5%. And also we are supposed to be seeing a steady decline in cases and hospitalizations over a 2 to 4 week period, and we obviously don't have that. We're going in the opposite direction.
Do any of the board members here work with a district that's still sticking to that hybrid model where some
I know that our district is. I know that we are. We, as it was stated earlier, there are some districts. We're not necessarily saying it's going to be that exact model, because as new information develops every day, our superintendent and our administrative staff are doing their absolute best to work to accommodate. But as it was mentioned earlier, we serve high-need students of color and low-income areas, and there are working parents who are considered essential workers who do have to go back to work. We do have teachers, some teachers that may be willing to come in a certain type of format, but I don't want to say anything concrete yet, because again, there's so much up in the air. But we do realize throughout districts reaching out to families and doing community surveys, the survey responses is that a lot of, in our district in particular, a lot of parents are looking to bring their children back to school with safety precautions in place. So we have to really work to help mitigate those students who have special needs, disabilities, different learning styles, and those who are just unable to distance learn.
Do you think that's possible by August 17th?
Of course not. This is why I'm here standing in solidarity with my colleagues. I don't have the right answer, and for the first time, I just don't know. But I know by continuous conversation and by working together, but also by having the support from our state and federal leaders not to threaten Title I districts of removing our funding when it should be actually tripled while we're going through this type of situation. This is a call to action that Governor Ducey meet with governing board members, that Kathy Hoffman meet with school board members, so that we can work on solutions to safely reopen our schools and also help meet the needs of our students.
We're going to be available for individual interviews for the next 5 minutes, but then after that, we're going to go ahead and walk this letter up to the governor's office. Thank you all for coming out.